Upstate Medical University in Syracuse, New York, invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amer Smith. A medical student from Upstate's Norton College of Medicine recently presented research at the American Academy of Otolaryngology-Head and Neck Surgery annual meeting. I'm talking about his findings with Amer Mansour. He's a fourth-year medical student. Welcome to the Informed Patient, Mr. Mansour.
Thank you, Amber. It's good to be here. I'm excited to talk about my research today.
Well, I'm curious how you chose the topic of hearing loss.
As you mentioned, I am a medical student and I'm applying into what's known as otolaryngology, or ear, nose, and throat, as my specialty. And I have a pretty long history of working in hearing and hearing loss, going back to some of my days in undergrad. And I discussed with one of our physicians, one of our doctors here, Dr. Quimby, about potential projects to learn about or to better characterize the population level trends of hearing in Central New York. I thought that would be an interesting topic to explore, seeing as it hasn't really been looked at in the past.
Well, how prevalent is hearing loss?
Generally, in the U.S. population, it's fairly prevalent. About 25% of people actually suffer from some level of hearing loss. That's about 1 in 4 people. And as I'm sure you probably could have guessed, as we age, that number increases. So once we reach about 75 years of age, more than half of the people in the United States do have some level of hearing loss. So fairly prevalent issue.
What differences jumped out at you in the research that you did?
Our data and our research really demonstrated some interesting insights. The main kind of factors that we were looking at that impacted hearing loss, we looked at a lot of social factors and socioeconomic factors. So we looked at how patients were referred based on their race or their socioeconomic class, based on household income or insurance status. And we found, I guess, one of the key findings was that the patients that were referred to us had a pretty significantly higher income when compared to the overall population of Syracuse. So the patients that were referred to us at Upstate ENT had an average income of about $72,000. That's an average household income. Whereas if you compare it to the overall median income of Syracuse and the surrounding area, that income is about 55 or in the mid 50s. So that tells us maybe that patients from a more advantaged socioeconomic class are more likely to be referred than some patients from disadvantaged classes.
So these are patients who went to their primary care provider either complaining about some problem with their hearing, or the provider came across that when they did their exam, and they either referred them to an ENT specialist or they didn't, it sounds like.
Yeah, that's correct. ENT is kind of a specialty field, so it's not really a primary care field. So we don't really see patients unless they're referred to us, as you mentioned, by a primary care or some other physician. So in order to be seen by us as ENTs, they would first have to be screened or identified to have some sort of ear, nose, or throat problem by a primary care physician.
So the data set that you worked with was patients who were referred to the ENT practice at Upstate. Do you know what year it was for?
I conducted the study at the beginning of this year, 2024, and the data that we looked at were from patients from the full calendar year, the previous year. So from January 1st of 2023 until December 31st of 2023.
Did you break it down by age or gender or race? I know you mentioned income. Did you look at other factors?
Yeah, this study is what's known as a retrospective chart review, which means we went through all the patients through the Upstate electronic medical record database that were referred to ENTs, and we collected data from those charts. And as you mentioned, age and gender were both collected, insurance status. We collected the patient's zip code and then used that data to estimate their household income because that income data was not readily available on their chart. And then beyond those social factors and data, we looked at some clinical or medical data, like how severe their hearing loss was and the types of treatments that they've tried in the past before seeing us to try to address that hearing loss.
Did your paper address any of the possible reasons for the disparity that you found in income?
Identifying any specific cause was a little bit outside the scope of our project, so we weren't able to identify specific causative factors, but we did certainly propose some theories based on our available data. And so we believe that patients with greater income, as I mentioned, are more likely to find the time to attend visits with medical professionals. We think they're more likely to be able to afford a day off work or afford childcare and make time to see medical professionals like the primary care physicians and us as well.
This is Upstate's The Informed Patient podcast. I'm your host, Amer Smith. I'm talking with fourth-year medical student Amer Mansour about the research he presented at the annual meeting of the American Academy of Otolaryngology. Now, I realize you're still a student, but do you know what is typically done for someone who comes to their primary care provider with trouble hearing?
From a primary care perspective, there really are two main things that a primary care physician can do when a patient comes to them complaining of hearing loss. The first is to just refer them out to an ENT, an otolaryngologist, so that they can get their hearing done and see the specialist that really focuses on hearing. And that's, I think, what most primary care physicians do. In other cases, there are certainly some primary care providers that are able to just prescribe and offer hearing aids directly from that primary care office.
Do you think there are patients who have some degree of hearing loss but don't tell their doctor about it?
I certainly do.
Why do you think that would be?
I think there are a couple of reasons. I think the main problem is that it's a little bit difficult to recognize when you have hearing loss, especially if it's not too significant or too impactful. I think some patients kind of have or show some compensatory behaviors, like they might speak louder so that they don't notice it, or they might turn the TV up a little bit louder or turn their phones up louder. So even though their hearing is declining, their environment's getting a little bit louder to match that. So they're not really impacted by it and they don't really see it as a big problem.
So, if they're recommended to try hearing aids and they get some over the counter, are those generally helpful for people, do you think?
Hearing aids are certainly very helpful. And I'm not totally sure about how much more helpful specifically tailored hearing aids are compared to ones that you can get over the counter. But there have been a lot of studies looking into how effective and how helpful hearing aids and implants are for patients with hearing loss. They've made pretty remarkable strides in the treatment of hearing loss.
Do you know if insurance usually covers hearing aids or even hearing testing or implants if someone was recommended for that? Is that generally something that's covered by insurance?
Of those three, health insurance generally, especially when it's medically necessary, is deemed by an ENT or a primary care physician. Insurance does generally cover the hearing testing, and that's known as an audiogram. But usually hearing aids are not covered. It does, of course, depend on the insurance plan and the insurance company that you're working with. But I think from what I remember, Medicare, I don't think covers hearing aids. So we think that this expensive medical technology is one of the main barriers to care that patients face when they are suffering from hearing loss.
Well, you mentioned how there's more hearing loss as we age. Are we all destined to lose our hearing, or are some of us protected from losing our hearing?
So as I mentioned earlier, it's estimated that more than half of us will lose at least part of our hearing by the time we're 75. And there are certainly some genetic factors and some environmental factors that we can't really control. But the main thing that patients can do is to decrease exposure to loud noises. Some common environments or areas where that is really prevalent is people that work in construction or in factories and even military personnel. A lot of those communities suffer from hearing loss because of the consistent elevated exposure to noise. And so in these contexts, adequate hearing protection is pretty important to prevent these issues. And then in our paper, we touched on some improved screening strategies that will allow us as healthcare providers to identify hearing loss in patients earlier so that they can be addressed in a timely manner.
I know you've been studying otolaryngology for quite a while. How did you choose this specialty? What interested you from the very beginning?
I'm a musician. I played the saxophone growing up. And in high school and middle school, I was always interested in science. And so in high school, actually, I wanted to combine these two interests in science and in music. So that's when I started doing some research. Over the summer, I did a couple of research internships in hearing and the biology of hearing. And that's kind of how that all kicked off my interest in otolaryngology.
So that hooked you, and what's going to keep you in the specialty? Is this something you can do for the rest of your life?
Well, yeah, I hope so. As I mentioned, I'm a fourth year medical student, so that means I'll be graduating in May. And I'm currently applying for a residency position in otolaryngology, which, as I kind of broke down earlier, involves hearing, nose, and throat. So ear, nose, and throat.
Good luck to you.
Yeah,
Thank you so much for making time to tell us about your work.
absolutely. Thank you. I appreciate the time.
My guest has been Amer Mansour, a fourth-year medical student at the Upstate Norton College of Medicine, who presented research recently at the American Academy of Otolaryngology-Head and Neck Surgery annual meeting. The Informed Patient is a podcast covering health, science, and medicine, Brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please tell a friend to listen too. You can rate and review the Informed Patient podcast on Spotify, Apple Podcast, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.